According to the National Cancer Institute, 39.5% of men and women will develop cancer during their lifetime, and 86.4% of you in this room said that you knew somebody that was diagnosed with cancer. Today I'm going to talk about a treatment called immunotherapy, and personally my mom has had this treatment for the past 4 years, and I've gotten to see how much hope this has given her and how much this has affected our life as a family. And according to the Cancer Research Institute, immunotherapy enhances the immune system's ability to recognize, target, and eliminate cancer cells wherever they are in the body, making it a potential universal answer to cancer. Now, this is a treatment that could give so much hope to patients if this could really treat all cancers. Now, today, the most important thing I'd like you to remember is that immunotherapy is a treatment that gives hope to patients that did not respond to traditional care. And today, I'm going to talk about 3 different types of immunotherapy and how they work, their side effects, and how effective each type of immunotherapy is. Now, for my first point, I'm going to use the article Understanding Immunotherapy, approved by the Cancer.net editorial board with over 150 medical professionals who specialize in oncology. And this article states that immunotherapy boosts the body's natural defenses to fight cancer and uses substances made by the body or a laboratory to improve how your immune system works to find and destroy cancer cells. Now, some types of immunotherapy destroy the cancer cells, while others just stop the cancer from spreading. So the first type I'm going to talk about today is called Tcell therapy, and this would be an example of one that destroys the cancer cells. Now, you might ask yourself, what is a T-cell? And this is a part of your immune system and is simply a white blood cell. So in this form of treatment, they redirect those white blood cells to specifically attack the cancer. And they redirect those white blood cells and they specifically attack the cancer and not your healthy cells. Now, for the next type I'm going to talk about is called monoclonal antibodies. And an antibody is also a part of your immune system that helps to fight infection. So in this type of treatment, they create molecules in a lab and they act as substitute antibodies, and they program them to specifically attack those cancer cells, and this helps to strengthen your immune system and attack that cancer. And for the last type, oncolytic virus therapy, this is a type where they aim a virus to kill cancer and they inject it into the cancer to help you fight off the cancer cells. Now, after talking a little bit about what immunotherapy is and 3 different types and how they work, I'd like to discuss some of the side effects. So according to the American Cancer Society, T-cell therapy can cause high fevers, low blood pressure, changes in the brain that could cause swelling, confusion, seizures, or even extreme headaches. And according to the Mayo Clinic, monoclonal antibodies can cause allergic reactions, flu-like symptoms, skin rashes, and low blood pressure. And for oncolytic virus therapy, the Cancer Research Institute states that this can cause chills, fatigue, flu-like symptoms, injection site pain, nausea, and fever. Now, they may just sound like words and very extreme symptoms, but these are just the most common ones. And you get to understand a little bit more about immunotherapy through these side effects. So when you compare it to a treatment called chemotherapy, this is where they attack both those healthy cells and those cancer cells. And you might see that someone would be losing their hair or have very weak or brittle nails. Now, you might still see this with immunotherapy, but it's not as common. Like, my mom has been treated with immunotherapy for the past 4 years, and she still has a full head of hair and healthy nails. Now that you've learned a little bit about those 3 types of immunotherapy and their side effects, I'd like to go in and talk about how effective each type can be. So for T-cell therapy, I'm going to use an example with lymphoma. So Claire Rodriguez, editor for labiotech.eu, says CAR T clinical trials, and that would just be referring to trials involving T-cell therapy, have shown huge remission rates of up to 94% in severe forms of blood cancer. And this is particularly impressive considering most CAR T clinical trials recruit cancer patients that have not responded to any, if not all, other available treatments. So you're taking patients that have not had hope with these other treatments, and you put them on immunotherapy, and they're having a 94% response rate. So you can imagine a loved one and their situation, and they have no hope, but once they have this treatment, they can finally have another chance at life. Now, for the second type, monoclonal antibodies, I'm going to use a personal example with my mom. Now, like I said, she's been on this treatment for 4 years, and I've gotten to see how much this has affected her and our family on a day-to-day basis. And she's had just these common symptoms, but she's still able to live a normal life. And our nurses at our hospital said that she would not be here today if it were not for this immunotherapy treatment. And for the last one, oncolytic virus therapy, I'm going to be using a 2004 trial published by the National Library of Medicine. Now, this says that an oncolytic virus drug called Oncrine had a 78.8% response rate when used with chemotherapy versus just 39.6% when it was chemotherapy alone. So you can see how it was just under 40%, and then it went from just below 80%. It almost doubled when they introduced the immunotherapy. and that can give hope to so many people who did not respond to those traditional treatments. Now, it can vary depending on the type of cancer, the drug that they're using, and the stage of the cancer, but in this particular case, it was used on squamous cell carcinoma and esophageal cancer. Now, with all that I've explained about immunotherapy, I'd like you to remember that immunotherapy is a relatively new treatment that is giving hope to patients that did not respond to traditional care. And today I've talked about what immunotherapy is, 3 specific types of immunotherapy, their side effects, and how effective each type is. Now, cancer is something that affects so many of our loved ones, and while immunotherapy helps to fight this cancer, it helps us spend time with them, and it gives them hope for their future and hope for our lives with them. Thank you.